So we are 39 in our Zoom platform, and the 38 students are with me now with our journey to know all about nursing informatics. Um, Actually, if I will go back to when the time I started my practice in the hospital. There are already embedded systems that really applied the concept and principles of technology. Uh, it so happened that during our time in 90s, in 90s, wherein uh, the systems and processes are still manual, and we do not have yet platforms for hospital information system. But nowadays, the hospital information system are are now being integrated in most of the healthcare facilities, even in the primary healthcare facilities, such as the health centers, and even in the specialty hospitals and rehabilitation centers. The access to healthcare also coincides with the access to information. Even the government, they have the advocacy pertaining to the access of freedom of information. However, it says limitation through the Data Privacy Act because we need also to protect the data subjects. Even in our own personal point of view, there is some information that must not have an access of everyone or the public. This Data Privacy Act could be one of the components as part of the processes. And indeed, it is also very important as part of our advocacy in the protection of the patient's Bill of Rights. As we have the concept of health informatics and nursing informatics, there is no such major difference at all. It so happened that if we say health informatics in general, this could be the application of the processing of data, information, and knowledge, wherein it could integrate and embed on how it could store, on how it could be considered for storage, how to have the access, and what are the functions that the of this data and information that will be very important for patient safety, that will be very important for the operations and operations of the healthcare facilities, or specifically the hospital, and how the nurse will benefit on the access for information. So we'll start with the basic concepts of nursing informatics. On the basic concepts, we will start with how the informatics is considered as science. Now, it is always part of our profession as future nurses, and even the concept of nursing, that we are on a science and an art principle. The science uh, definitely considered on how systematically we process information, on how systematically we process um, patient care. So that's why it includes, or it highlighted the what we call nursing process. So when it comes to the informatics in general, it is the science from the time that you gather the data, on how you utilize the data, and how this data will be significant for utilization depending on its purpose. Now, as we say, information is the science on how to use the data, the information, and the knowledge. Now, let us have the difference of data, information, and knowledge. Once you encounter a term or a word that do not have any definition, okay? For example, care. The term care may have different definition, because it could be operational definition, it could be conceptual definition. If we say conceptual definition, this could be universally acceptable to everyone. And if we say operational definition, the care can be defined accordingly to a certain circumstance or situation, just like nursing. Okay, for example, when we associate care to everyone, care could be a care that can be described. This is a data, a care that can be described by the level or perception by doctor. Care can be defined differently by a psychologist. Care can be defined differently on the level of a social worker. So for nurses, we define care as holistic. So although it's common, but it may vary specifically on how it will identify care as a distinct to its profession. So if we say nursing care, now from the term itself care that had been combined with nursing, it will define accordingly as a care referring to the discharge of performance of nurses in relation to patient care management. So we know, and it is clearly defined, it's served now as information. Now, how it will serve as a knowledge? When we use nursing care management, so if we use nursing care management, we use the concept of the principle of nursing as a science, caring as an essential component, and management that will encompass the what we call use of nursing process, the assessment, the ADPI, the assessment, the diagnosis, the planning, implementation, and evaluation. So this is how the informatics goes to the use of concept of the data, information, and knowledge. Sir, can you give us another example? I know you have encountered in many of news, social media, the use of healthcare worker. If we use healthcare worker, this could be considered as data. Why it is data? Because it's broad. Okay? It's broad. Any terms that you may encounter that may encompass other situations, that may encompass other principles, these are data. No definite identity if we say data. So going back to the term healthcare worker, if it is a healthcare worker, then we can say that this could be medical doctors, nurses, medical laboratory scientists or medical technologists, pharmacists. The healthcare itself is very broad. Workers itself is very broad. So even though we combine healthcare workers, it can still define many components that may address us with the term healthcare worker. How about information? Okay, if we say nursing healthcare workforce. Okay, nursing healthcare workforce. So we identify the healthcare, we identify the nursing. So if we say nursing healthcare workforce, we're talking about manpower, we're talking about workers, we're talking about employee. Because of the term nursing, this already serves as an information because we can clearly define what is healthcare workforce or healthcare workers or just nursing healthcare, but sometimes they are not using it. It's usually healthcare workforce. So this we say nursing healthcare workforce, it is always associated with nurses. If we say healthcare workers, it may associate many professions. But the most common denominator is that of health related. Okay. How about if it is knowledge? Knowledge now could be nursing healthcare service. Okay? If we say nursing healthcare service, this pertains to the knowledge that the nurses who render services identical. Okay, identical for nurses. So this is on how we differentiate the concepts of data, information, and knowledge. And once we combine this data, information, and knowledge, it process the information and use of the science and technology, then that comes informatics. That where informatics comes in. Its purpose of why we use the informatics, first and foremost, I know, for convenience. If you will try to observe in a typical health center during the time of vaccination, although even in our common vaccination centers, um, you have seen the use of the the laptops. And why is it? Because the laptop itself can store information, can store the information. Okay, but how it could be translated into information? Who is the source of data? So the source of data will be the person who will be vaccinated. Now, the person who will be vaccinated will supplement information. Or that's why we consider it as information, because the person will now enter the data into a platform that will be considered to store in that laptop. How it will become knowledge? From the information that had been stored in the laptop, it will now identify if the person with the information provided and processed will be cleared for vaccination. So that comes in the what we call knowledge. So that is where informatics comes in. Now, sir, how about if we are not using the informatics? We are just using the manual way of gathering data. Simply with the form that 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 we have. So kung form siya, data lang 'yon. Okay? No information are reflected in the form, data, because you can identify there the data needed. So that's why it is on the level of data. Once the person filled out the data, then that becomes information to support the data. Now, if those information comes now to a point of its purpose, for example, the nurse who will refer the client for a surgery, then the form with the information will be useful now for his or her clearance prior to surgery. And that comes in knowledge. So regardless if we have informatics or we are used on a traditional way of processing information, nurses are involved in this 1, 2, and 3. It so happened that it embed informatics. The process become more efficient. If we will try to compare that the lead time, if it will be entered, for example, in an application, the data needed, you supplement it with information, then once you proceed to the facility, you can easily pass through because of the clearance. Just like when you enter in school, why we emphasize the MCU trace. The MCU trace application, once you download or rather you access the application, the institutional application, it may need username and password. Now, that is already when you see username and password, those are data. But once you filled out your username and password, that is already information. And once this information have been processed into the system, it opened the application or the platform wherein you will fill out other information. Once you completed the information and submit it, the health services department is now, the information that you have entered into the MCU trace is now a knowledge. Why? Because the health services is now knowledgeable of your health status upon entry in the campus. So this is how we consider data, information, and knowledge. And when it comes to the healthcare informatics, it is the use of information and technology combined. The information will be coming from the source. And in nursing, we have considered reliability. When it comes to the reliability, usually when we interview clients, the clients are the most reliable source of information. If the client is unconscious, it goes on a lower level of reliability if the source of information goes with immediate family members or with a friend. While when we use the technology itself is how the information will be processed. Just like as mentioned by the QSEN in 2003, that the use of the information and the technology to communicate, it manage knowledge, it mitigate error. Mitigate meaning it prevent error and support decision making. Now, let's put it in a setup of a hospital on the use of the information and technology. For example, a client will be subject for second dose of vaccination. Before the client will be subject for the second dose of vaccination, you will again instruct the client to fill out the form. The data are already listed there. Now, the client entered significant information. So the data is now converted into information. Now, the hospital has this hospital information system wherein you will just have a screen that will enter the data. It may not need a pen to accomplish the form. Now, this information will be cascaded to the clinic of the doctor who will have the clearance for the second dose. Now, the client is in the outpatient department, but the doctor is at home. So how the client will have his clearance for the second dose? Since the doctor is using the platform or has the access of the platform of the hospital to access the information of the patient, it may support decision making simply because the accessibility of the doctor can review the first dose of the client to support that if the visit of the client in the hospital is on the date that is supposedly he had been advised. Second, if it verified with this condition that he could be subject na for vaccination. And third, the doctor cleared the client with the information referred by the nurse on vital signs. Those information were processed remotely. The nurse, the client is in the outpatient department. The nurse is in the vaccination area. The doctor is at home. They are not in one area. And that comes in technology. How information was processed? The information was processed because it has a channel to give feedback. So, did it mitigate error? Yes, it prevent the error because the doctor has the authority to give the clearance even though the doctor is not physically present in the outpatient department. Does it support decision making? The answer is yes. The decision for the doctor to have clearance of the client to be vaccinated was sent through the platform of hospital information system. So these are situations that are very relevant nowadays. We are talking also of health informatics as revolutionizing caring and use or direct to improve our situation in the healthcare system. If we say revolutionizing kasi we have used first industrial revolution. If you go back to your history, and just recently we have used fourth industrial revolution. We have used VUCA world, volatility, ambiguity, complexity, volatility, VUCA. Yeah, volatility, and we have the complexity, and we have the ambiguity, uncertainty, letter U. So we are using these terms already because it is very relevant on how a nurse will see the picture in the future. If we say revolution, it entails transformation. This transformation that is relevant on how it will lead to improvement. Now, if we combine revolutionizing and improvement together, there is transformation, there will be improvement, but what will be our indicator to measure that we have attained? Okay, we have attained our goal or objective when it comes to healthcare system. Quality. Okay, the quality. The quality that we're talking about is certainly outcomes. And that comes out that the essence of caring had been felt by the patient through a very satisfactory feedback. So that's why even the client who had been admitted in the hospital, they will actually process evaluation and feedback from the services of the departments of the hospital to the manpower from the time that the client had been admitted and at the time that the client will be discharged. How revolutionizing comes in the practice of healthcare? Revolutionizing comes in is the client will have an evaluation that can access or that can fill out the data needed for that survey evaluation through the use of a platform in the hospital information system. Unlike before, if we go back to our manual setup meaning the traditional setup, we have interviews just to gather the needed information from the data provided. But nowadays, even the client can download applications for the patients to have access in the hospital information system of the institution. And through the mobile phone, he can process all the needed information, and once submit, it will cascade to the storage and centralized office of the information system of the hospital. Once all of this feedback will be centralized into one storage, the next thing is that of how it will be analyzed. Di ba usually, analysis of data may need statistics. And with that statistics, it will give us a clear view of data that has been combined. And we can see the picture when it comes to distribution, when it comes to the percentage that had been identified as feedback for every item of the survey. So how revolutionizing as a concept comes in? Revolutionizing is if we will go back to the historical milestone from the time that you need to interview all the 10 items, the client transformation has transformed that the nurse may not need anymore to have an interview to give the feedback. Because there are situations now when you have the platform to give the feedback on the hospital survey, since it may need confidentiality, the client could be anonymously identified in that platform. For interview, if the client will have direct answers, probably the client may not fully divulge or disclose all the feedbacks that he or she may have. So that's the difference from the before and now. Now, usually we have identified principles of computer and information science. That's why during the time that it evolved yung use of technology, it evolved also in the education yung courses or rather yung programs of computer science, information technology, because it always centralized on the perspective that the concept of information can be generated through the use of technology. Kaya that's why we have uh, information, if I'm not mistaken, we have also engineering for that is related to the information technology. So this is on how those individuals who have been involved in those programs can use information into the perspective from the data information to a higher level of knowledge. Higher level because it could be accessible and its impact could be the lead time on how it will measure efficiency. So when we say computer, I know for a fact that during your high school days, you have been oriented about the parts of the computer, and we have the keyboard, we have the monitor, the CPU, and so forth. But the most important part of the computer is the CPU, wherein all the information are stored there. But can you imagine how all of the information are stored? Because it has a memory. So anytime, if the person need to access the information through the computer, he may just be knowledgeable on how to process it when you have the competencies specifically on technical skills on how to retrieve information using the computer. But why it now integrated yung principle with computer and information science combined? Kasi the computer are more on the perspective that it will consider the use of technical aspect on how the information can be stored, can be protected. But the use of the information science is how this information can be translated into knowledge. And that comes in science. Now, there are four principles. There are four principles that are very important when it comes to the application of health informatics and applying or considering computer and information science principle. Number one, we have advancement of life sciences research. Number two, health professions education. Number three, public health. And number four, we have patient care. If we say advancement of life sciences research, for example, for the operations of hospital, if we say the word, if we use the word advancement, Oh, advanced yung facility na yon. It measures also the satisfaction level of the stakeholders on how fast the pacing of services have been achieved. So since the hospital has the hospital information system, wherein it may not need any more manpower, but you are given the autonomy to process the needed data and enter the information on using a specific platform. Unlike before, you will proceed step by step. Step 1, with the person who will interview. Step 2, you will fill out the form. Step 3, you will submit the form. Step 4 will be submitted to the other department. But now, with the advancement of life sciences in a hospital, you can just stay in one corner, but you are already completing the 4 phases and steps that you need so that you may get an appointment for a clinic consultation visit. And that is advancement. Another advancement of life sciences and research is that of nursing care management. In the nursing care management, when you are about to process the nursing care plan and it's already the second hospitalization of the client, will you need the information of the first hospitalization of the client? Yes, because you will correlate the present situation of the client's health condition if it is connected from the first hospitalization. And that may give us the idea if it has the same diagnosis, then we will weigh through the use of nursing process if the condition of the client have aggravated or have developed complications. Now, and in the advancement of life sciences, when you are formulating your nursing care plan, you will definitely need information such as you have been oriented on subjective and objective data. For subjective data, you will definitely ask the client. But for the objective data, there could be instances that when you are assigning the ward, you may need information coming from the nurse from the emergency room to serve as a baseline information for you to know about the chief complaint of that client and the initial vital signs. Now, are these information very important? Yes. If in 1 hour that the client has a baseline vital signs and your client had been admitted in the ward wherein you're assigned in that area, you may not anymore need to go down or to proceed on the first floor and ask the nurse. You may not need anymore to call the nurse to validate the information. You can just have an access on the hospital information system, on the data, or rather on the information that had been entered by the nurse assigned in the ER and who attended the client. Will there be a possibility of problems when it comes to an error if you will not validate it with the nurse, concerned nurse assigned to the patient in the ER? You can still do, and you must do, because again, when it comes to the technology, there are still, even though with advancement, we still need to review the literature on how this concept have evolved. You will check some of the problems that had been encountered on the first implementation of the hospital information system. Are there any concerns related to errors? If the nurse is knowledgeable on it, that error is also possible, then as a rationalization of what you will do when it comes to validation of the nurse is very significant, because the first, sabi ko nga sa inyo, di ba, the most reliable person, the most reliable information will come from the person themselves. So even though we have the advancement, the nurse instinct can still validate reliability, or can still consider reliability to the concerned person who attended to the client. Another advancement of life sciences and research using computer in information science. You have heard about green hospital. What is this green hospital? Nowadays, we have encountered problems with climate change, and we need to balance on how to take care of environment. So now, the green hospital was conceptualized on the use of the environmental, the ecological principle, and embed it with the hospital. So that advancement in life sciences and research using computer information science will be validated if, for example, do the client who have been admitted in the green hospital may have shorter stay and recovered eventually in a shorter span of time. That could be information. And how it will be translated into knowledge. Since with the information that you have known, that most of the clients have been admitted in green hospitals have shorter stay compared to other hospital with the same degree of diagnosis of the client, then this becomes a knowledge if the practice that are being done in that green hospital will be now benchmarked and also adapt in other hospitals. So that becomes a knowledge to everyone. Okay, that's why it's very important that when you do research, it will not just only on the four corners of the library. It is needed to be published. Why? Once you will lead to the level of publication, it may reach a wider audience for them to appreciate the findings of your research. And that becomes the use of the information science that can be accessed by other individuals and may process it into their setup and may have its implication on their policies, on the improvement of services, and on development of the manpower. So that comes in the combination of computer and information science on the advancement of life sciences and research. How about the use of principle of computer and information science in health professions education? In health professions education, we have identified, just like Manila Central University, and one of which is nursing. Why is it that in the BSN curriculum, we have integrated nursing informatics? It is simply because that since each generation have different experience on the use of technology, these experiences can be an answer on future problems. Just like, for example, in the health education sector, we have not we are not expecting that we will have pandemic and there will be a change in the landscape of the system when it comes to a face-to-face now on online and goes back again to a hybrid mode. But it may not be the same as to what we have experienced during your high school and during your lower year level experiences. I know, second year, you have not even experienced pa the classroom management in MCU because you have been oriented on an educational delivery utilizing the flexible learning system. However, with the health informatics, what could be the advantage of being immersed and exposed into this system. We may have advantages, we may have disadvantages, because we all know that that's why even the Commission on Higher Education is pushing all institutions to have limited face-to-face classes. It's because on the perspective that there are skills that can be learned through an actual performance and actual setting. So in the health professions education, the paradigm shift that we experience is part of health informatics. This is on how students are already prepared on the use of technology in your future professional practice. Just like, for example, we've heard about telehealth, we've heard about telemedicine, we've heard about teleconsultation. And through the use of various technological platforms, a client may not anymore visit uh, an actual clinic consultation. A person can just use the mobile and have a video call with the doctor, or a Zoom platform wherein the doctor can give advice to the client. I know there are some disadvantages because you may not see the whole picture of the client's assessment, because we have mentioned that from the subjective data, then that could be possible. But for the objective data, we may just rely on results. We may just rely on the findings, or diagnostic exam results, vital signs. But for the holistic uh, results of physical examination, that sets limitations. But there are some instances that in the use of this technology, it may need yung perspective that the client must proceed in an actual setup of the clinic because all the services are available. There are some services that is more efficient and effective if the client will avail it on a physical face-to-face. So in the health professions education, it is somehow on how the students from a school setup are gearing towards the use of technology in the professional practice. So that's why even now, even in your nursing informatics laboratory, you will be introduced into the various setup and immersed to various setup, introduced to experts on how they utilize health informatics as part of the nursing profession. And sooner, we could have invitations to experienced nurses, nurse informaticists, who can give you, who can share with you her knowledge, acquired knowledge, skills, and attitude from the time that he or she had been oriented on concepts in nursing informatics and on how nursing informatics benefited him or her in the practice. Next, public health. When it comes to the public health, we all know that these are more on a non-hospital facility. It's on a community base. Now, when we talk about public health, actually, when we talk about hospital services, it is still public health. Kaya that's why when we talk public health, it is not just health centers. When we talk public health, all healthcare facilities in the community. So that's why it has a more or broad it has a broader scope of practice. So that's why when we talk about public health, I know for a fact that you had your community health nursing. You had also your assessment with families, and you have identified the needs of the family. You have identified if it is health threat, health deficit, or foreseeable crisis. It can identify specifically prioritization. But how you process the information and end up with the intervention, even it has a limitation when it comes to interactions to actual patients. It's again through the use of technology. The information was processed through the use of technology, and that comes in health informatics. How about for patient care? For patient care, when it comes to the principles of computer and information science, patient care comes in if we consider remote nursing service, it may associate also giving high independence for the patient to be more alert, to be more knowledgeable, and to be more competent. It's a two-way process. In an actual setup, the patient is dependent on the nurse's competencies. He may or she may ask many questions when a nurse attends to an actual patient in a hospital setup. But when the client, this is related to ambulatory patients at home, they could use various platforms to monitor the client. That's why we have telehealth, we have the teleconsult, and the the telehealth, specifically the nursing use of nursing informatics principles. So in the use of the nursing informatics and use of this information science, we can continuously monitor the client's condition. Just like, for example, when we try to monitor, when we need rather, when we need information, so data is blood sugar. Information will come from the result. Okay? And how it becomes knowledge? It becomes knowledge if the nurse will use those information for the intervention that the client must do with his or her condition. So with that typical example, when it comes to patient care, the nurse coordinates with the client on a remote facility. It's not face-to-face. But she just asks the level of blood sugar she have at 6 o'clock p.m. prior to insulin administration. I know for everyone, sir, to what extent that the client is knowledgeable and skilled to retrieve the accurate result of blood sugar. So that's why the point that the nurse will be at the time that he or she need to first or primarily assess the readiness of the client and the level of knowledge of the client. So the importance of assistance of the nurse is to teach the client primarily on how to get an accurate result of blood sugar. Now, when you assess that the client is now competent, at first the nurse may perform face-to-face checking of the blood sugar. But if the client is already confident and competent on how to get the blood sugar, then with this level of confidence, the nurse can now retrieve the level of blood sugar even it's on a remote delivery or access. This is on how the four advancement of life sciences research, health professions education, public health, and patient care are important in the application of computer in information science. Now, in a multidisciplinary and interactive field focuses, we have the so-called health information technologies. Okay? Yung health information technologies or HIT. HIT. It involves computer, it involves cognitive, and it involves social sciences. Remember, class, that the computer itself is the hardware. The cognitive is the measure of your knowledge. And three, the social sciences is on how you will connect to your target audience or stakeholder. Let's put it on this perspective. We have a laptop. Are you knowledgeable on using the laptop? The answer is yes. Do you know how to save data or how you translate the data into information? The answer is yes. Do you know how to retrieve or access data when needed? The answer is yes. Now, the presence or the access on the laptop is a tool wherein information can be stored. But this information cannot be processed without the number 2, your knowledge. Your knowledge is very important on how you will use the laptop and the information stored. Now, how it will become social science? Just like in this way, our interaction through the Zoom platform is use of the social platform. I am teaching to you remotely, but still having interaction when I ask questions. You're responding to me when I ask questions, and if you have questions, I respond to you. It is still part of the connection, but we are on a remote area or facility. So this is how health information technology includes the 3 areas. What are the goals of health informatics? Actually, the goal of health informatics is always improve and enable. If we say improve, it means that the measure of quality are being appreciated. If it is enable, it means that it escalates to a higher level of development compared to the previous situations or events. So your explanation are very broad. So let us have the specific on the number 1. Improve patient care at the individual and clinical level. Individual, if the client has high level of independence, if the client is managing his or her own health condition in the absence of a healthcare practitioner, it gives high level of independence. Another is improve patient care at the clinical level. At the clinical level, we're considering hospital facility. How can we improve patient care? In the hospital facility, the difference is that we have all the access for manpower specialists, all the diagnostic examination and laboratories. But when it comes to the access to information, we have the hospital information system for a nurse to be on red alert if in case the condition of the client is critical or may have a high risk condition. It alarmed you through the use of the system in the hospital. You may not have talked to someone, but based from your access to information, you have already gathered the information and translated to the knowledge of the nurse on how she or he will strategically consider effective nursing care and successful nursing care plan. Another is improve the health of entire population. So this is more on geographical. So just like on the improvement of the health of the entire population, for example, why the Department of Health are having daily updates on number of COVID-19 cases active, number of COVID-19 deaths, and number of COVID-19 recovery. This is for the entire country, ha? How the Department of Health gathered those information? It is still the use of health informatics. They have accredited, okay? They have accredited diagnostic facilities and hospitals. So that's why generation of report follow through every 2 o'clock p.m. because the Department of Health will give updates at 4 o'clock p.m. So all the information, so they have a cutoff that every 2 o'clock they need to update the registry when it comes to those who have positive results or confirmatory results. And for the hospitals, those who have leaded to mortality and those who have recovered from cases. So imagine the whole country can generate the information in just every 24 hours. And that's the use of the health informatics. Even with the geographical, with the limitations on geographical areas, it can still facilitate prevention. That's why every policies of the government is is changing because we rely on the information provided by the Department of Health. We also, the IATF also rely or has been dependent with the information provided by the DOH when it comes to alert level system. When it comes to the number 3, enable health organizations to deliver care more cost effectively. Okay. Sir, what is cost effective? For example, for an individual who will visit the hospital clinic, the person will prepare at home. The person will have transportation expenses. As he goes to the hospital, he spend more time to wait because of the long queue of patients who had appointment for consultation. Then another is sometimes it reach the lunch break, so you need to eat. So these activities have allocated cost. But once you consider telehealth or teleconsultation in your own homes, it is cost effective because you will not anymore have transportation expenses. You may not anymore have expenses on your meals because you can just maximize the resources that you have at home. Although at home, the use of the electricity and the use of the internet could be part of the expenses, but not the same as what you will do when you will have your face-to-face consultation. We are not getting rid or we're not getting out of the picture yung face-to-face consultation because as much as possible we encourage it. But with these certain limitations of the conditions that we have now an alternative of enabling the health organization to deliver care more cost effective. Okay? Kasi situations like there are some instances na yung access to information supposedly we could if we could have the telehealth, we could just consult the doctor. Now we are having the conditions that I'm attending now to our client. So preventive because you have the access to the manpower, use of technology. But if you do not have any access to the manpower and the persons surrounding the client who have an emergency situation may not be attended without anyone who's an expert to intervene or to render the appropriate intervention on that condition. So at least on that situation that we can have access, doctors can just give instructions and the family members can attend to the client at home and to support preventive measures. Let us now have the application of health informatics. Let us now differentiate nursing informatics from clinical informatics. When we talk about nursing informatics, informatics is the use of the information technology and involving nurses. So most of the activities that we consider for nurses are patient care and documentation because nurses are are in 24 hours duty, and with the continuing rotation, we can access the progress of care and the documentation from the start of hospitalization up to the day that the nurse render her service to the client. Can track it can track the needed information so that you can provide quality care to the client. Kasi for example, if the doctor will instruct you, what could be our nutritional management for the client? Do you need information? Yes. First and foremost, you need information if the client has allergies. Second, you need to take into consideration the history of the client that could be relevant in the preparation of nutritional plan. Third is through the information that will be provided by the IT system or hospital information system, it can give you preventive measures so that it may associate appropriately the nutritional plan or the diet plan that is appropriate for the patient. It's the use of the nursing informatics. Now, what is the difference between the clinical informatics? Usually, the clinical informatics in general, all who are part of the healthcare team. Kasi pag nursing informatics, the nurse alone has the access to the information of the patient. But for clinical informatics, the allied health professions may have an access for the patient information. So that's the difference. So that for clinical informatics, these are more on the care management involving other professions collaboratively and collectively. This is for clinical informatics. For nursing informatics, it is more on how the nurse will have her or his own nursing care plan. Now, when it comes to the Chief Nursing Information Officer, the Chief Nursing Information Officer is the highest position, okay? The highest position that had been considered related on the use of health informatics in a facility. Just like in the nursing service department, we have chief nurse. But if we say chief nursing information officer, she's the one in charge on how to facilitate yung principles that we have mentioned about information science, data, information, and knowledge. And through the use of the technology. So those are the expected skills. Now, if you are the chief nursing information officer, you cover all the responsibilities of each services in the hospital related to processing of information and using the hospital platform to have this information process safely and protected ang patient. How about the chief medical, that's a wrong spelling, chief medical information officer. For chief medical information officer, the difference is that of the chief nursing information officer greatly involved nurses in the process. But the chief medical information officer, his or her responsibility covers nurses and other profession. So that's the difference. That's like what I have mentioned about the difference between nursing informatics and clinical informatics. Clinical informatics could be collaborative. Nursing informatics could be for nurses. Chief Nursing Information Officer could be in the nursing service who will be more focused on the processes. The Chief Medical Information Officer involves all the professions and departments in the hospital. While when we talk about nursing service, when we talk about the nursing service, this will specify the nursing service is the one that is responsible for the use of IT technology in the processing of information of the client, such as EHR. EHR meaning electronic health records. It's not, we have the e-chart already. The e-chart that you're seeing in the hospital, it's not anymore like that. It could be accessed into a computer, even through the hospital information system. That's for the nursing service. Now, for the medical, again, it's collaborative. All the healthcare personnel integrated technology into the day-to-day patient care of the client. Not necessarily nurses alone, but also the nutritionists, the laboratory scientists or the medical technologists, the pharmacists, so that it could be more holistic yung approach using technology. That's more on the medical. While on the nursing service, the use of the technology that involves nurses. And the chief for the nursing service is the chief nursing officer. Now, to give you a background on what are the other careers that we may consider in health informatics, let us watch the video. And after watching the video, we will have our health break.
Today we are here to talk about the exciting opportunities in the field of health informatics, otherwise known as HI. You may be more familiar with the name medical records. In the past, medical records consisted of handwritten notes, x-ray and laboratory reports, and other information, all documented on paper and put together into one file, which was then put into large rooms. Whenever the need arose to review the records of a specific patient, the patient's file would be retrieved from the filing room and delivered to the requesting physician or clinician. Today, the U.S. healthcare industry is trying to implement health information technology for all providers and related businesses. This requires a new workforce with specific training in health information technology. So, what specifically is health informatics? HI is the application of information processing involving both the computer hardware and software. It deals with the storage, retrieval, sharing, and use of healthcare information, data, and knowledge, including its communication and for decision-making. Nothing in healthcare occurs without the information. For example, when we go to the doctor or the hospital, they take down certain information, such as height, weight, or blood pressure. This information often includes diagnoses of conditions we may have, as well as lab results and prescription medications. A term you might hear when people are talking about health informatics is the electronic health record, or EHR. The EHR is a real-time patient health record with access to tools that can be used to aid clinicians in decision-making using the most current knowledge available. The EHR can automate and streamline a clinician's workflow, ensuring that all clinical information is communicated when and where it is needed. So, where do health informatics employees work? They work in a variety of settings, including hospitals, ambulatory care clinics, private physician practices such as your doctor's office, skilled nursing facilities, and military MVA facilities. They also work for EHR vendors in which they help to develop, program, sell, and implement the various EHR products. Or they can work in higher education, meaning in universities and community colleges, as educators, researchers, and innovators of health informatics. What kinds of roles do health informatics workers fill? Again, many different ones. For example, at the entry level, one can choose to become an HIM clerk or medical records specialist, in which one primarily works with the patient records. Typically, the education level necessary for an entry-level role is a 2-year or associate's degree. Or they can choose an intermediate role, including supervisor or manager, data analyst, or implementation specialist. A data analyst uses statistical techniques to rearrange health information into patterns and categories that can be useful for many different purposes. An implementation specialist is someone who installs hardware or software for the healthcare organization. Usually, in order to be in an intermediate role, you need a 4-year or bachelor's degree and applicable work experience. There are even advanced career levels on the HI pathway. Some of these include a quality director, who is responsible for ensuring the organization is meeting its patient care quality goals, or a chief information officer or CIO, leading the IT investment and implementation strategies, or a chief knowledge officer, CKO, someone who is responsible for converting data into knowledge the organization can use. Someone at this level has a bachelor's or master's degree with lots of work experience. These people really are the experts. What kinds of skills do you need for these roles? There are different categories of necessary skills, such as technical, workplace, academic, and personal effectiveness skills. For example, a technical skill would be to have some knowledge of medical terminology, to know the language of medicine and related words. Have you ever heard a doctor read your blood pressure? Usually they say something like 120/80, and you think, what does that mean? Learning medical terminology would help. It is important to keep health information private and secure. This requires the knowledge of the applicable laws and regulations. What about workplace skills? They are also necessary. Collaborating or being able to work with others is critical when you are assigned to a team and you need to finish the project together. Knowing what the different HI products do and how they can be used most effectively in a variety of settings is also vital for HIT workers. Academic skills are also important. You must be able to read and understand assignments, memos, and other deliverables given to you from your supervisors. You must also be able to write clearly and concisely, as well as think innovatively in order to produce results. Personal effectiveness skills are important. This means being able to work together as a team, effectively communicating, showing up to work on time, and proving you are dependable. And you must also be able to demonstrate adaptability during assignments or projects. So what type of education is available in Texas for health informatics? There are 2 Bachelor's of Health Information Management degree programs available in Texas. One is available at Texas State University in San Marcos and the other at Texas Southern University in Houston. Both offer campus classes where the students enter as a junior, having already completed their Texas required core classes. Texas State also offers its classes in an online format. The 4+1 program is a dual program between UT Health and other 4-year universities. It is open to students pursuing an undergraduate degree in biomedical sciences, biology, nursing, mathematics, and computer science. While enrolled, the 4+1 program students will take 5 courses with the School of Biomedical Informatics that will constitute a graduate certificate in health informatics. At the conclusion of their undergraduate degree, students will have obtained both their bachelor's and the graduate certificate. Those students who wish to continue on to their master's degree will have only an additional year of classes instead of 2 years to complete a master's degree. The master's and doctoral degree programs are both available from the University of Texas Health Science Center School of Biomedical Informatics at Houston. We offer a Master's of Science in Health Informatics with a traditional and applied track and a Doctor of Philosophy degree in Health Informatics. For additional information regarding our academic programs, visit our website at sbmi.uth.edu/applynow. It is safe to say that health informatics is an innovative field, and there is a high demand for HI workers in the nation, with up to 50,000 new jobs. A recent study estimated that Texas would need an additional 10,000 workers in health informatics. There are many opportunities out there. HI, or health informatics, is a fast-growing field with more jobs added than any other industry. From 2007 to 2011, health informatics jobs have grown faster than many other fields. The U.S. Bureau of Labor Statistics is also predicting large growth in this field for the future. The need for health information technicians is expected to increase by 21% between 2010 and 2020 in response to increased demand for healthcare and increased use of technology in healthcare. Remember though, while training and education in health information technology is important, many employers are looking for that healthcare piece in health informatics. Although IT is an integral part of HI is different than IT. In healthcare, the lives of the patients, you, me, and our families and friends are at stake. The technology implemented can change the way care is delivered to patients. Healthcare employers are going out of their way to hire health informatics professionals instead of IT professionals. All in all, there is a lot of opportunity for a career in health informatics. We hope to see you soon at the School of Biomedical Informatics.
Okay, so from the video presented, you have seen and observed that there are various skills that are very important when it comes to your engagement into health informatics. And if you have also observed in the presentation of the Texas University, they have also shifted to the offerings of programs that are related to health informatics, even in the undergraduate program and graduate programs on the master's and the doctorate degree programs. Because as mentioned, information technology personnel may have the skills, but on the perspective of combining your competencies when it comes to your knowledge in health and through the use of the technology, then that comes in healthcare informatics. Now, when it comes to the benefits of healthcare informatics seen as a potential method for improving the delivery of quality healthcare. It is on the perspective that it may benefit the client on the appropriate decision making. It may give you real-time information so that to facilitate appropriate care management. Another is when we talk about minimizing errors, nowadays we are using QR codes, barcoding, we're using electronic health records, medication, computerized healthcare provider order entry, and we have the patient care alert and reminders. That's why when we use this or when we maximize the use of healthcare informatics, this, as what we have mentioned, provide high level of independence for the clients for them to even interpret their own health conditions. But I'm not saying that we will disregard the healthcare providers. In minimizing the errors, records are very important, and accessibility of the healthcare providers such as nurses are being used on the computerized functions. That's why even protection and data privacy are also being considered as part of the ethical issues. However, these are being concerned or being considered rather as part of the measures in healthcare informatics on how we will still protect the access and how we will protect the rights of the data subjects who are our stakeholders. Another benefit is healthcare informatics may provide meaningful use of electronic health records. Why do we use meaningful? Meaningful because this electronic health records and use of technology can have the exchange of information from one person to another person in a remote facility, even from one person to another person from the national to abroad. And we can access also specialists if we wish to access credible information from specialists, even you are in the local setting, the meaningful exchange of information could be possible through the use of the healthcare informatics. Actually, when it comes to the access, even the family members can also interact with the attending physicians of the clients for more family-oriented and collective care management. Coordination are being efficient are efficient simply because it may improve on how the family members may be also competent when it comes to attending to the client's condition. And since it starts with the family, it may also improve the community and the public health if ever this will become the best practice. So probably we may have first our health break before we continue with the succeeding parts of our topic. Thank you very much and be back after 15 minutes. Thank you. So again, we will continue our discussion for the uh, succeeding topics on nursing informatics. So we ended up with the topic 1A. So we have now the topic 1B, all about nursing informatics on key points of data, information, and knowledge. So we have already defined the difference between data, information, knowledge, but on our phase two of the topic one, we will get deeper on our understanding about data, information, and knowledge. So, as what I have mentioned to you, that if if when it comes to data, these are just terms, numbers that you have encountered, but it could give many interpretations. Very broad, very general. These are data. Just like one of the examples that I set is in a blank form. Just like for example, the data is name. There are many names that we can indicate there, but once the name will be filled out by someone and indicated the name, it's served now as an information. Okay? Then when the name indicated in the form have been used to identify if the patient is presently hospitalized or admitted in the hospital, then that becomes knowledge. So in those perspective, the data are terms and numbers, but for the information, it will give us complete meaning. Yan. So the information are defined. Yon data that are defined. Kaya data that are defined, data with meaning, these are information. So another typical example, just like demographic profile, gender. Oh, if we're talking about the gender, what gender are you talking about? If we talk about the information, the data with meaning, female. Oh, now it gives you a clear view of what you need when it comes to the data. When we describe female, we can express ourselves confidently on how to define the gender when it comes to female. And now, when it comes to the knowledge, this is on how the data and the information are combined so that this will be useful. Ayan na. If this will be useful na, this will be considered as knowledge. Now, just like for the observations, terms, numbers, and symbols, data, 98.6. If we have 98.6, what is 98.6? 'Di ba? You are on a perspective of hanging. 98.6 could be a temperature. Ayan, could be a survey says a temperature in degrees Fahrenheit. Yan. 98.6 could be the level of oxygen saturation. Ayan. So there are many uh, perceptions that we may connect. Example, 89. 89 is heart rate. Do 89 age? So so those are considerations. Another, kanina we mentioned gender. That could be data. Pero dito, yung female that have been considered as data, kasi when we consider the female, it encompasses age. 'Di ba? Female, it encompasses also status. Female, it can encompasses also profession or occupation. So that's why it's very broad. Very broad. So when it comes to the information, ayan, data with meaning. O tulad nung minention ko sa inyo kanina, the 98.6 are the normal temperature reading. Okay? 89 could be age kasi it matters yan kung 98.6, okay, normal reference yan, normal temperature reading. For for the degrees Fahrenheit. For the 89, it's considered as age and female as gender. it gives us it gives us meaning and direction of what are being asked. When we consider it as a knowledge, ayan, go back. When we consider this as a knowledge, the 98.6 degrees Fahrenheit, okay, degrees Fahrenheit is now a normal temperature reading. Then we conclude, ayan, we conclude that the patient is well. Then that translates into knowledge. 89. 89 could be the age at pwede ring weight. So, it may depend pa if the 89 is on pounds and kilograms. So, yan yung mga, these are the questions that have been addressed when it comes to the level of data. And as female, as gender. Meron pa kasi kung female, data yan. Female ba? Human ba? Or animal? Yun din. So, now, when we will try to have the key points on data, information, and knowledge, let's have yung connection. That's why in the presentation of this framework, the clinician and the healthcare intervention matters so that we may proceed to an effective patient outcomes. We may identify a problem, but how we can lead to appropriate patient outcomes. And that may need the expertise of the clinician or healthcare professionals. And through this intervention, it encompasses yung, that's why it's in the center, it looped healthcare intervention because it may depend on the competencies of the nurse and the direction to patient outcomes based from the problem. So that's why from this framework, we cannot identify specifically the connection, but if you will use your acquired knowledge from the previous courses that you have completed, you can connect it. But seemingly, each one of you may have different interpretation. Example, in a real world, a public health nurse visited high-risk pregnant teen with substance use problems who needed health care. Okay. Public health nurse could be an information. Kasi it identify, di ba? It identify the specific nurse. And the nature of his work as public health, in the public health. Now, when it comes to high-risk pregnant teen, our concern here is very generic because it did not indicate the age. Because yung teen age group ano yan, may range. So still a data with substance use problems. Okay, substance use. There are many substance. Yan. There are many substance. So it can answer the what, when, where, and so forth and how. Substance use problems. Data pa rin. Now, who needed healthcare? What healthcare does she need? So, if it concerns in a real world of this statement, and you have many questions that have not been answered, it's on the level of data. But how it becomes information? O, eto na yung information. Paano natin itatranslate na yung basic, this is the real world, and this is the theory. So yung public health nurse, specific na yan. But we have more questions. Kaya if you will analyze the statement, the question is high risk pregnant. Why high risk? O, hindi nasagot. What is the age? May question ka. If you have a hanging question, then it serves as a data. Substance use problem. What substance? When yung din sa high risk pregnant, pwede ring tanungin yung age of gestation, yung mga basic information na yon. So hanging pa rin. And the needed healthcare. So that's why when you question yung statement, high risk pregnant, substance use, needed healthcare, you are in your mind creating your own theory because you are using your own perception that wait, I have questions, many questions related to this statement. public health nurse, I do not have question because I am aware of what a public health nurse is. But for the next is high risk pregnant. Why make her high risk? What age? What is the history? Yon. So now, if we consider this now, yung kinonsider natin for theory, high risk pregnant teen, substance use problem, needed healthcare. So tignan natin ngayon, demographic data. If we say demographic data, this may consider the age, this may consider the gender, so obviously it's female. So demographic data yon, civil status, demographic data. Now, when it comes to the data, we have considered the demographic data, obviously female. Health, what problem terms? What is the problem? So use of substance. Pero what substance is it? Healthcare intervention. What intervention? What the needed healthcare is needed? What outcome measures must be done? So now, when we talk about this, yung data itself can be analyzed through that framework that I presented a while ago, na yung high risk pregnant, I need demographic data. uh, it's still data because many questions are hanging. So lahat yon, yung statement na yon are data. So next statement, tignan natin kung is it data or information. Critical care nurse. I do not have any question because it's already specified of a critical care nurse. Next, pediatric client. Pediatric client, very generic. Very generic. What age are we referring to the pediatric client? With congenital defects. Hanging, you are again hanging. Data po ito. There are many congenital defects. Next, that may need immediate care. What immediate care does she need? So those are hanging. Is this data or information? The answer is, when we are considering the theory, yung na-mention natin kanina na may mga hanging questions tayo, pediatric client, congenital defects, need immediate care, because you may not consider it as information because hanging tayo sa sa 4 W's and H. So that's why it's a data. Now, paano natin ipapasok kung bakit data? Kasi we cannot identify it's a pediatric, what age group of a pediatric client kasi demographic data. Yung pediatric client, anong gender? That's part of demographic data. Yung problem terms. Ano yung problem terms dyan? Congenital defects. What congenital? Meron tayong meron tayong congenital heart defects, meron tayong congenital malformations, marami. So, ano yung immediate care? Immediate, what emergency interventions, and what is the expected outcome? So still data. When we talk about semantic tools, the semantic tools, this helps transform or convert data into useful information. So meaning, ito yung meaning tools. Ibig sabihin, we can access a platform, we can access a source that may give us useful information. Just like for now, you are most of the time using the search engine of Google, and it gives you information. So those are semantic tools. If we say semantic naman, it relates meaning and language. Meaning, the language that we're talking about is, for example, if we talk about caring. If we talk about caring and if you search it on the search engine, di ba you will choose the meaning that could relate and what meaning that is appropriate that you are looking for based from the situation. So, ito yung mga examples po natin. Ang examples po natin, just like controlled vocabularies. Pag controlled vocabularies, words that have definition and represented by codes. Example, RX o RX, prescription yon. So, it already set to mind, controlled vocabularies, alam na natin yan. RN, registered nurse, controlled vocabulary na yan. ICD, international control codes. So, these are controlled vocabularies na even in medication administration, we're already aware of what does it mean. BID, 2 times a day. But what does BID? Buy in die. So those are controlled vocabularies. Now, when it comes to taxonomies naman define terms and interrelationships. Just like for example, sa clustering of diseases. Sa taxonomies, yung it will give us a definitive relationship when it comes to, for example, respiratory diseases. Respiratory diseases ang dami. Sa taxonomy of respiratory diseases, we have pediatric and adult. Nag-branch out na siya into 2. So, ano, merong mga respiratory diseases that are identified only in adult but not in children or pediatric clients. So, in those cases, it may give us a direction that most that is considered for adults, most that those diseases are considered for pediatric clients. So it gives us yung association and relationship when it comes to identity. Example, when we say stroke, okay, when we say stroke or cerebrovascular accident, obviously it affects blood vessels and brain. And brain is part of the central nervous system. So we can connect yung taxonomy. So we can expound. Yun yung tinatawag natin taxonomies or ontologies. When we talk about interface terminologies, these are terms that facilitate direct entry of information into computer. So direct, example interface technology. Pag interface, you open a platform and you supplement and supply information. Yun yung interface terminologies. Example, name, you enter your name. Address, you enter the address. Yun na yung mga interface terminologies. Aware ka that once you open up an electronic health records and it indicate their name, address, and you are asked to fill out, hindi address ng other patients ang ilalagay mo, yung address mo or yung basic information mo that are needed there. Name, address, sex, name, address, gender, civil status are demographic profile. But seemingly, once you encounter these applications, you are aware that your basic information is the one that will be needed depending on the instruction. Okay. Next po, I'll just finish the next slide. Next po, on the interface technology, we have the reference technology at reference terminologies. If we say reference terminologies, these are set of concept and relationship that provide common reference. Ano yung common reference? Example, this is usually this is more on comparison, more on data, yung data driven, yung example, data of COVID-19. So aware tayo what source can be what reference can be accessed, yung most credible and reliable. So if we will go back to these key points on controlled vocabularies are those words that already have codes but clear to us. Yun nga lang kasi for the other courses or for other programs, they may not understand this if they are not in the allied health science. But for those who may have in the allied health science, they can understand it. So, yung RX, may intindihan ito by taxonomy ng allied health science, doctors, pharmacists, nurses. When it comes to interface terminologies, this is basically on how you will enter information based from the data. Then when we talk about reference terminologies, these are already established sources, web links. Yan. Next, interoperability standards. So I think I may end up to this. The interoperability standards are usually technical standards for exchange, integration, and sharing. Class, this is the term if the information can be accessed by one or two or more. Kaya, for example, if a nurse, the doctor are most common professions who are holistically administering treatment and care to the client. So expect mo that the nurse and the doctor may exchange and share information. So the term itself is sharing and exchanging of information. That is interoperability standards. So again, since it's almost time, I may end up to this part and I may stop the recording.